Hi friends, my name is Jessica and I'm a second-year doctoral student studying nursing practice. And in today's video, I want to talk to you about why we should no longer use the term illness. And I know you're probably like, what? But while I was conducting some research for my doctoral program, I came across this article that talked about why we should no longer be using the term illness. And it really resonated with me. And I thought, wow, more nurses and medical providers and the entire interdisciplinary team really should know about this concept because it really makes so much sense and really makes such a difference in patient outcomes and the patient overall experience. So the idea is that the term illness creates a stigma for the patient and increases stress because it places the patient in the sick role. So where do we hear the term illness in practice? Well, this happens a lot with mental illness or with chronic illness. When it comes to mental illness, the DSM-5 actually has excluded the term illness for this reason. Some other words that we can use in place of illness that doesn't have this negative connotation is disorder or disease. The research has showed us that when we use the term disease or disorder, the patient doesn't take on the sick role. It actually creates an entire different experience for the patient. Research has showed us that when a patient is diagnosed with an illness, that it can actually disrupt their identity as an individual. So what can we do as nurses or medical care providers is when we talk to the patient and we discuss a diagnosis, we can use words like disease or disorder instead of illness. When discussing with a patient treatment plans or goals or providing education, we can supplement the word illness for disorder or disease and affect the patient's well-being and overall experience of dealing with whatever disorder that they have. In summary, what this means is that by just changing our language, we can actually change the entire patient experience. We can be the ones who help a patient feel like they're in a sick role or not in a sick role. And this is especially true if we just take a second and think about ourselves. If we went to the doctor and found out that we had some type of medical condition and they said, you have a chronic illness or you have a mental illness, what does that feel like for you? I did this with myself and I felt like when using the word illness, it made me feel like it was something I could never get rid of. Like it was there, it was with me. However, now think about if you went to the doctor and they said, you have a disorder, you have a chronic disorder, or you have a mental disorder. It kind of feels like it's something that you could heal, that you could make better. It still kind of gives you the power and the control. So I wanted to make this video because when I came across this research, I thought, why is this not taught in nursing school? Why is this not something that we learn about during orientation? And I really want to get that message out there to other nurses and medical providers or anyone providing patient care because we can really change the patient experience for the better by just changing our language when we approach them or speak to them about something that's going on with them. So I hope you guys enjoyed this video. This is kind of just like a little fun fact, but I hope that you bring this knowledge into your practice. And if you're interested, I will link that article down below so you can read it for yourself if you would like. And if you enjoyed this video, make sure to give it a thumbs up and subscribe below, and I will see you guys next time. Thanks. Bye.